Hello, my name's Cara, I'm 19 and I'm a second year adult nursing student at City University of London. I'm going to be talking to you today about the course itself, my experience so far, and how I'm finding living in London. At the end of my 3 years, not only will I have an undergraduate degree, but I will also have a professional qualification that will allow me to register with the NMC to be a registered nurse both in the UK and globally. As the role of the nurse is so practical, the teaching style of this course is a mixture between theory, simulated practice, and then about half our time is spent on placement. Theory is delivered through lectures, tutorials, labs, and seminars, which is great because the variety keeps it really engaging. I think it's important to note here the separation between theory and placement blocks on this course. It's actually one of the reasons why I chose this course, because keeping them so separate means that you can focus on one and the other and don't have to stress about balancing both. Simulated practice is where we go to the clinical skills suite at university and practice all the skills that we need to know to be a nurse. This is one of my favourite aspects of the course for me because it allows us to practice all of our skills in low pressure environment and not having to stress about being in a real healthcare setting. We can ask as many questions as we want, and also it's just so much fun. The space we do it in at university is incredible. It's like a full working ward with dummies for when we're not pretending to be patients ourselves. Thinking about what the course is like in terms of actual learning content, I think the best way to summarise it is that you learn everything you need to be a successful nurse. So we have biology modules that run throughout the 3 years that underpins everything we do, obviously. And then we also have practical modules. So for example, I just finished acute care management. And then we also have modules that give us a wider picture of health, such as public health and how to use current evidence to provide best practice. And then in second year, we also have an elective module. I think the key message I want to portray here is that everything we learn is relevant. This makes it so much easier to learn because you know it's all going to be useful, even when it is difficult. So moving on to placement now, the first thing I want to talk about is where I go. Once you begin the course, you declare your trust preferences, and then once you're allocated, you'll spend your whole 3 years in that trust. So I was allocated into Bart's Trust, which means that I can work in any of the hospitals in there, which are St Bart's, Royal London, Whips, Newham and Mile End. The other trust that adult nursing students can go to is Homerton and North Middlesex, depending on your location and personal circumstances. One of the things I was interested in learning about before I started this course is what it's actually like to be a student nurse in a real healthcare environment. When on placement, you work full-time, so usually about 40 hours a week, and you follow the rota of your supervisor. Depending on where your placement is depends on your shift patterns, but usually it's 12.5-hour shifts from about 8 till 8:30. One of the best things about placement is that students are counted as supernumerary, so we have the opportunity to learn as much as we want and take up all opportunities. The best advice I can give is to be as proactive as you can when you're on placement. For example, I've managed to see heart surgeries as well as shadow nurse practitioners for a day just to see what it's like. It goes back to that old saying, the more you put in, the more you're going to get out from the experience. Placement gives you the opportunity to put all of your theory into practice, which is obviously really enjoyable because at the end of the day, we're all here to become nurses, so this is what we want to be doing. One of the reasons I chose London to do this course was because of the transport system. I found that a lot of courses that aren't in London expected you to travel quite a distance for placement, whereas in London you can get a tube or a bus and you can get anywhere with ease, which is so good for placement as well as social life. This is something that I've really learned to appreciate over my time on this course so far, as having the ability to get on a bus or a train and be wherever you are in 20 minutes is so useful. In first year, I stayed in Romano Court student accommodation, which I could not recommend highly enough. Accommodation gives you the opportunity to live in central London, which normally as a student you just wouldn't be able to afford, which gives you this unique opportunity that you probably won't have again. This year I'm in a privately rented house with my university friends, which has been brilliant because not only am I learning about adult responsibilities like paying bills and budgeting, but I'm also being able to have a laugh with my mates. This year, especially with COVID and online learning, I've learned to appreciate how important it is to enjoy the company of the people you live with, as I think it makes a massive difference to your university experience. So I'd really advise for any prospective students to think about this carefully, as I think it makes a big difference. I hope I've been able to give you some information today about what it's like to be a student nurse in London. Thank you!